We'll go ahead and get started here. Thanks for throwing some introductions in the chat there. It's always fun to see where everyone's from, and I'm always impressed by the diversity of geographic regions where folks join us from. So it's very encouraging, and appreciate you spending some time with us here this evening. So welcome to our third webinar here in our 2026 educational series. It's great to have everyone. This webinar is going to focus on urinary calculi and coccidiosis. We have Dr. Heather Glennon with us this evening, and Dr. Glennon is relatively new to extension, but not new to small ruminant production. And I'm going to let her give a little bit more background on herself and her history and experience with small ruminants. But really excited to have Dr. Glennon with us. She's the new extension director in Nash County here in North Carolina, and also serves as a livestock agent in that county. So a goat expert and someone that excited to have on the extension team here working with us on the small ruminant side of things. And so I'm going to let her take over here and share some thoughts on urinary calculi and coccidiosis management. Just remember, if you can stay on mute, keep your video off for now. We just want to make sure everyone's internet service stays strong through the presentation. And then if you have any questions, feel free to type them in the chat. And then there'll be some breaks during the presentation here where you can unmute yourself and ask some questions if you'd rather ask your question that way. So again, thanks for joining us. I'm going to turn the floor over to Dr. Glennon.
Thanks, Andrew. I'm excited to be here tonight to talk to some fellow sheep and goat enthusiasts. As Andrew said, I do have a passion for goats. I started raising dairy goats when I was in 4-H many years ago, and absolutely loved raising dairy goats, and moved to North Carolina to start my graduate work at NC State, and got a lot of experience working with meat goats at the small ruminant education unit. That's where I did my master's and PhD research, working with forages and parasite control in sheep and goats. So I was blessed to be able to get my degrees while I was working at NC State and gain all that knowledge. For the past 10 years, I was down at the University of Mount Olive teaching in the animal science program down there and starting their small ruminant unit for their animal science and vet bioscience students. But now I'm back home in Nash County, and I have started as the extension director and livestock agent. So you'll see a lot of pictures of goats in the slides, and that's no slight to Dr. Weaver. I just don't have a whole lot of pictures of sheep. I tried my best to find a few. So I have limited experience personally with my goats and urinary calculi. But of course, raising hundreds of baby goats every year, I've had my fair share of coccidiosis. So right now I have a commercial meat goat farm. They're part boar, part Kiko, and we just sell them for meat production right now. So at one time I had over 100, but I am paring those animals down. So, really excited to be able to share with you guys and answer your questions. All right, so first we'll start talking about urinary calculi, or it could be called water belly. Basically, these calculi are stones, usually made up of phosphate salts, that get lodged in the urinary tract, especially of male sheep and goats. And they are painful, and when they build up enough, they can prevent urination in the animals. In a very severe case of urinary calculi that doesn't get treated, the bladder could actually rupture. The urine would leak into the peritoneal cavity and get into the bloodstream, and then ultimately the animal would die. This is a very old historical picture of urinary calculi, but if you notice, the animal has some edema down here in the belly. That's where the bladder has burst, and it is standing in a hunched position. That's one of the signs that your animal is in discomfort and maybe has urinary calculi. And there are several causes to urinary calculi, but what makes it complicated is the male tract, the urinary tract of the male sheep and goat. There are two areas specifically where these salts can get lodged or built up. Right here in the sigmoid flexor, those phosphate salts can get stuck or lodged. And then down here, it's called the pizzle or the urethra process. It's a tiny little instrument that comes out of the penis, and the stones can get lodged and not be able to actually exit the animal. So because males have a really long and narrow urethra and this S turn right here in their tract, that's what makes them a little bit more susceptible than females to having urinary calculi that they cannot pass. So ultimately, what is the cause, or why do these phosphate salts build up? Most of the time, it is a imbalance in the diet. And a lot of folks who feed concentrate or grain feeds, they could be pets, they could be show owners, they could be just really well-fed breeding animals. Those grains are really high in phosphorus and really low in calcium. And if you look down here at the bottom, some of these grains that are normally included in a concentrate are very low. Say like corn down here is very low in calcium and very high in phosphorus. Well, for a ruminant animal, we like that calcium phosphorus ratio to be 2 to 1. So if we look here, the corn is actually backwards, right? There is a lot more phosphorus than there is calcium in corn. And all of these grains follow the same suit. So when you are feeding a lot of concentrates or a lot of grains to your animal, you have proportionately high phosphorus and not enough calcium. So these salts will build up. One way to alleviate that is feed more roughages or forages in the diet. Generally, they're more balanced than grains, and legumes such as clover and alfalfa and lespedeza are higher in calcium, so they can actually balance out that high phosphorus in the grain. So really, it's improper feeding of the animal that is causing these salts to build up. Another thing that could help concentrate these salts is if the animal doesn't get enough water. So if you're thinking in the wintertime, maybe it's really cold and that you have icy water, or in the summertime, it's very hot and there's a lot of algae that has grown in the water bucket. This can discourage the animals from drinking water, and they really do need to drink water to try to dilute those salts to help it pass better in the urine. So who is at risk? Actually, all animals can get these phosphate salts, but really we're looking at wethers or young lambs and young kids, especially that have been castrated under 30 days of age. So there's lots of different trains of thought on when and how you should castrate your young male animals. The younger they are, the less stress it is going to cause on them, and they will rebound a lot better. But by doing that, you are stopping the testosterone production that would have allowed the penis and the urethra to reach full size. So that would have a better chance of allowing those salts to pass. So one thing that I would do as a meat goat producer is I would ask myself, do I really need to castrate these young males? Not that I was going to have them enter into the breeding herd, but intact young males actually will grow faster than wethers. They will be a little leaner than wethers. And if you process them at a young enough age, there will not be any distaste in the meat. So generally, I sold my buck kids at 5 or 6 months old, and I did not castrate them so that I could get them to grow a little faster than if I would have weathered them. If you are raising show wethers, that's a whole completely different story. You definitely would need to have them castrated, and a lot of those folks wait until they're a little bit older because they are going to be feeding them a high grain diet, and that is a huge risk for them to get urinary calculi. So intact males can also be impacted. The only animal that I've ever raised that got urinary calculi was a 3-year-old breeding ram, and he was actually living with some calves that we were finishing out. So obviously they were eating a lot of grain because we were trying to fatten them up, and we had no other place to put the ram, so he was hanging out with the steers. Until I noticed that he had urinary calculi. And so that was our fault for putting him in that situation where he was improperly fed for what he needed. Again, females can get stones. They can get the phosphate stones or calcium stones, but their anatomy allows for easier passage. So usually we don't have a problem with them not being able to urinate. So if you go out to your field or your barn or your pasture and you ask yourself, okay, you just kind of doing the skimming everybody, do they all look okay? Do they all sound okay? If you see some of these symptoms, you might want to double check. It starts out with restlessness, kicking at the belly. Obviously, they have some pain because they're full of urine or they have these salts that they're lodged. Vocalization, abdominal pain, urine dribbling. This is how I knew the ram had problems. He was living kind of like in a dry lot with those calves, and it was in the middle of the summer. And I always would, not always, I would go out there, and when this was happening, his belly, especially where his penis was covered in dirt. And that was unusual for just that small area of his belly to be covered in dirt. And so upon further inspection, I could tell that he had been dribbling urine and he wasn't able to really have a full stream. So you'll notice them straining to urinate, and that could cause some blood to be seen in the urine. A hunched up appearance because they're in pain. Um, if it goes too far, the urethra, like I said, could rupture, and then you could have some edema under the belly as well. This is a pretty, severe case at this point in time. So the main thing is definitely observe your animals and spend time with them, know what's normal and know what's not normal. So, what can you do if you see this happening? Definitely, you want to act quickly. Like I said, the bladder could burst, and then you would have to euthanize your animal at that point in time. You can administer ammonium chloride. This recipe is sort of like a recipe that I use. So, I would always work with the veterinarian to see what they would suggest, of course. But ammonium chloride is going to help. Lower the pH, make it more acidic of the urine so that it can break up those salts. So what I would do is administer this ammonium chloride for several days in water. It does have a bitter taste to it, so drenching it in the animal, obviously you're making the animal drink it, but if you had a little bit of flavor to it, they may not fight you as much. You could talk to your veterinarian to see if smooth muscle relaxants or anti-inflammatory medicine would assist with the comfort of the animal. I've never had to do this myself. Maybe Dr. Andrew Weaver could say if he's ever had to snip off the little end of the penis there, the urethra process to allow calculi to pass. That may allow little stones to pass. Anything further up in the urinary tract probably is going to require surgery by a veterinarian. And then, of course, you may consider euthanasia if it's too bad. So before we even talk about treating it, let's talk about, preventing it at your home or at your farm. And it all comes back down to proper feeding is going to reduce the risk. Of course, your wethers are going to be more at risk than your other animals, but if you're feeding them properly, it might not necessarily matter that you have castrated them at a few days of age because they have that proper calcium to phosphorus ratio in their diet and those salts are not building up. So if you remember back when I showed the slide about the corn and the barley and the oats, the cereal grains, they can be flip-flopped and they have 10 times as much phosphorus as calcium. And what we're really hoping for is twice as much calcium as phosphorus. So how can we add calcium into the diet? One way is to add ground limestone, which is calcium as a mineral, or you can add some legumes. Like I said, clovers or alfalfa or lespedeza, peanut hay, anything that's a legume will help add calcium to the diet. Now, on the flip side of that, if you were to feed a weather 100% alfalfa diet, you might also get some calcium stones to build up that they may not be able to pass. Um, but adding calcium into the diet any way you can is going to help. A lot of people that I have met may not talk to, I should say, you should probably talk with someone who's a little well versed in nutrition before you start putting supplements or mixing feeds, especially if you're just going to add corn to an already high grain diet, thinking that corn is going to help them grow faster or put more weight on or more fat. You may be altering that calcium to phosphorus ratio in the diet if you decide to put handfuls of corn as top dressing on the animal's daily ration. Including forages, whether they're legumes or just grasses, would help because the more forage or fiber the animal is given, the more cud chewing is going to occur. We like cud chewing. Animals, like sheep and goats, are ruminants, so they have a four-chamber stomach with a rumen that needs to be a specific pH. When they chew their cud more frequently, they make more saliva, which helps to buffer the pH of the rumen, which keeps them healthy. But also, that saliva helps to bring up phosphorus, which is then coming into the digestive system and passed in the feces rather than the urinary system. So if you have a diet that's really high in phosphorus, but you give them a lot of forages to chew, maybe some of that phosphorus will exit via the digestive tract rather than the urinary tract. Some other things that you can do to prevent it. There are many commercial feeds that already add ammonium chloride into their mixture if it's 0.5% to 1%. And again, that is going to help acidify the urine. You want that pH to be below a 6.5, and you can very easily test that with a very normal test strip to see what the pH of the urine of your animals is. Again, making sure that they have fresh, clean water to help dilute those salts and help them pass better is going to be advantageous. How can you make them drink more water? Increase their salt intake. And that, just like if we eat something really salty, we'll drink something afterwards, so will the animals. So there's discussion whether or not, you should use a salt block or a loose salt or loose salt kind of granulars that you would put out several times a day. Whatever your animals will eat the most of, I would say, whatever works best for your situation, you should do. But having free choice minerals out there for them may not ensure that everyone is getting all of the minerals that they need. Unless you are intentionally putting a specific amount of minerals in their ration every day, you're not going to know how much each animal is getting. So while putting free choice minerals out is a good thing, you just don't know if they're getting the extra calcium that you want them to get, or whatever it is you're hoping to get out of those free choice minerals. So you can put the free choice minerals out, but you're just not going to be sure how much each of them is going to get if they're in a group setting. Now, obviously, if you're feeding them individually, you would be able to record that. If your animals are still having urinary calculi issues and you are pretty sure that you're giving them a good balanced diet, you may want to then look at your hay source or your water source to see if maybe those are higher in phosphorus or are contributing to the salts as well. Okay. So urinary calculi boils down to proper feeding of those animals and possibly castrating them at an older age so that they have more time to develop their urinary system. So I'm going to stop here. I absolutely love grazing animals and growing forages. So I'll just share a picture of some of our commercial does eating some Bermuda grass. If anybody has some questions about urinary calculi, I'll take them here, and then we can continue on to coccidiosis.
It looks like we do have a couple questions in the chat.
Okay.
So someone asked, in sheep, I've heard to simply push the testes into the body cavity versus banding them in reference to castration. Do you have any thoughts on that? I guess that'd be like short scrotuming versus truly castrating.
I'll let you answer that one, Andrew, Dr. Weaver.
So there is some work on that. Some folks do that. So the chance of them being fertile and actually being able to breed females is relatively low. But you still get some of the male behaviors that could be unfavorable if those animals get too old. So um, there's some pros and cons to it. If you're going to still sell them at a relatively young age, if you're keeping your males and females separate, I'm not really sure there's much point to doing that. If you only have one pen and you have to keep all the males and females together and you're potentially going to have them around past maturity, that could be one solution if you didn't want to fully ban them and castrate them. Our market, though, typically rewards animals that are still intact. So if you can keep those animals separate and keep those males intact, you're probably going to be it's probably going to be beneficial from a urinary calculi prevention standpoint as well as a market standpoint.
Yeah, when I had my males, I would wean everybody at 3 months of age, and then I would keep the males and females separate. And then between 5 and 6 months of age, I would sell those males that were still intact, and I got a good price for them. And I know that the meat was um, still tasted good. Yeah.
Yeah, I figure as long as what they're separated by about 4 months is my rule of thumb, you're pretty safe.
Hmm.
There was a question, clarification, is this relevant to sheep as well as goats? And someone did type in the chat, yes. So yeah, everything here is directly transferable to sheep. Is there any chance that too much phosphorus can cause buildup as well?
Too much buildup of the phosphorus. Yeah, the phosphorus in the diet. If you feed too much phosphorus in the diet, you are going to end up with phosphate salts in the urinary tract. You'll also get a buildup of phosphorus on your pastures if you feed a lot of phosphorus because it's going to be excreted in the feces. So I'm not sure which direction that question was headed.
Yeah, see, Max, if you've got any clarification of that question, we can certainly come back to that. Another question, in humans, we use Flomax to help relax muscles so the stones can pass easier. Do we have anything like that with sheep and goats?
I'm just gonna not plead the fifth, but say really talk to your veterinarian when prescribing those types of medications for your animals.
Yeah, and I will second that. There's another question for sheep. What is a good feed, and should I be giving corn as well with the feed?
So I would say no, just off the top of my head, just don't add corn willy-nilly to your mix of your feed. You the first thing when you're trying to figure out a ration for your animals is you have to figure out what they need as far as energy and protein requirements. And that's going to change based on the age of the animal, whether they're pregnant, whether they're lactating. And so that protein or energy level could be very low or very high depending on where they are in their life cycle. Once you figure that out, there are some nutrient requirements out there online that you can find that say, if your growing kid is 55 pounds and you want them to gain a half a pound a day, this is how much protein and energy you should feed them. If you wanted to get very technical, you can figure that out. Most of the bagged feeds that you would buy at a feed store are a good supplement to a high forage diet. I always recommend that a large portion of a ruminant's diet should be forage or fiber based, whether that is green grass or hay or some type of pellets or cubes. And then you use the grain on top of that to add whatever additional energy or protein is not being met by the forage component. So that's how I would go about figuring out what to feed your animal.
And then there was a comment, I'm not sure exactly what it was in reference to. And Sean, if you don't mind maybe adding some clarification, it says research showed goats needed like 8 teaspoons for about a week pulsing protocol to really go down to 6.5 proper pH. I think he might be referring to ammonium chloride. Have you read this? Also, tiny dosages of AC, maybe referring to ammonium chloride. Is that bad?
Um, what I have seen as far as how many teaspoons of ammonium chloride you're going to need, it's not been more than 2 or 3 per 100 pounds of animal per day. You would do that twice a day. So say you needed 2 or 3 teaspoons of ammonium chloride, but you're giving it every 12 hours for 2, 3, 4, 5 days in a row. That's what I would suggest. But again, I would hope that you would have a relationship with your veterinarian and you could get some clarification from them as well.
And then do you mind just touching on what are your thoughts on the mineral buffet versus the complete mineral mix? Do you have a preference for one or the other that you use in your operation, or have you heard of thoughts, opinions on one versus the other?
I have seen a lot of folks who are starting to go to that mineral buffet. I have not tried it with my animals. I give them a complete goat mineral that I offer to them. It's free choice, but I free choice 3 times a week. What I've noticed about my animals is that they're very wasteful, and so I just put out enough mineral 3 times a week that I know that they're going to clean it all up right away. And I know at certain times of the year they don't clean it up as quickly as other times, and so they are actually meeting their own needs there. But I'm using a complete commercial mineral mix that you could buy at a feed store.
Yeah, and I generally recommend the complete mineral mix. My concern with the buffet is, are they really getting each of those minerals that they need? I don't think they really necessarily know that they need each one, and they might overeat one and undereat another. And feeding the complete mineral probably gets a more appropriate um, intake of all the minerals that they need.
And some minerals could be more bitter than others, and that could affect their intake as well, too.
And then there was just a comment. I feel like the old person out. I tend to pasture raise with hay in winter and only supplement with grain with lactating ewes. And someone else commented that they're not the odd person out, and a lot of people do it that way. Any thoughts regarding, 100% grass-based, pasture-based production systems?
With my animals that I have, the only time that I'm going to feed grain, if I need to, is if I'm kidding, say in January or February, and I don't have enough like winter annual pasture to graze them on. I'm going to supplement those lactating does so that they do have enough milk for their kids. And I generally I generally don't creep feed my kids after weaning. I'll touch a little bit about that in the coccidia talk about what I do with my weaned animals. But the only time that I would use grain in my operation is during kidding in severe winter where it's cold and there's not a lot of good pasture or a lot of good hay. My animals at home haven't had grain in a year. They've been fed either all hay or all grain diet. So I mean all hay or all pasture diet. So it just depends on what your management goals are. If you want a faster growing young animal to sell in a more timely manner, grain is going to help you get there, but you don't need that if you prefer to go all forage based.
And then there was a question, any thoughts about using Replamine? I think I pronounced that right. Weekly. Honestly, I'm not sure what that is, but have you
I
heard of
have,
that?
no, I have not heard of that. I'm sorry.
Um, we can, if you're still interested, reach out to us, send us an email, and we can maybe look into that a little bit further, or speak with your vet. Ultimately, if it's a treatment based question, that's going to need to be your vet providing that answer to you.
Yes. While I have a lot of knowledge from raising animals myself, I can only tell you what I have done and what has worked for me. I can't really give any, treatment guidelines for you because I am not a veterinarian. I did not go to veterinary school. So, all right, should we move on?
Yeah, we can do that. There's one quick
Oh,
clarification
sure.
question. I think you can answer this pretty quick. When you're talking about only forage for feed, you're not talking about dairy animals, correct?
It would depend on your management goals. If you wanted a sufficient amount of milk, you're definitely going to need grains or supplemental feeds to get more milk in the milk pail. There are some dairies that are all, these are cow dairies, they're not goat dairies. There are some cow dairies that are all pasture based, but again, their goals are different. So if you're wanting higher production, grain is going to get you there.
And then just real quick before you jump into coccidiosis, there was a comment about someone had heard a talk from Dr. Vinson at Penn State about some mineral feeding, and I would recommend any of his talks. I know he's done a podcast with the American Sheep Industry Association. He's done a webinar with the Eastern Alliance for Production Katahdins, and if you search EAPK, they've got that recording on their website. An excellent mineral nutritionist, and highly recommend going and listening to one of his talks if you're interested in learning more about mineral programs. So with that, I'll turn the floor back over to you, Dr. Glennon, and let you continue on with the second half here.
All right, thank you. Okay, so now we're going to be learning about poop. I saw two different titles for this talk. One was urinary calculi and scours, and one was urinary calculi and coccidiosis. So some people use the term scours just to cover the whole gamut of diarrheal issues. We are going to concentrate today on coccidiosis specifically, but I have spent dozens of years researching other parasites that affect sheep and goats. So at the end, if you've got questions about them, we'll try to answer them. The sample on the top left here, that is obviously what a normal, healthy sheep and goat fecal sample should look like. On the right at the top, this is an animal that is heavily parasitized with tapeworms. In my whole 40 years of raising goats, I've only had one that has ever died from tapeworms, and it did have severe diarrhea that we just couldn't get under control. And when it was necropsied, we found that it was tapeworms. But generally, tapeworms are not going to be pathogenic or cause diarrhea like our coccidia will. And so this is a fecal sample on the bottom, and you might look at that and say, oh, that came from a cow, but goats and sheep that have diarrhea could potentially also excrete something that looks like that. Now, clearly this is signifying an unhealthy animal. When I go out to the barn or the field every morning, the first place I look is everybody's hind end because there are so many reasons why a small ruminant could get diarrhea. One could be the weather changed and it got cold. And, one could be they were grazing in the woods for the past couple of days and ate something different and got diarrhea. So I'm always looking at the hind end of my animals. And then I always, look at their face because with parasites and bottle jaw, which is really rampant here in North Carolina, and small ruminants, you can see parasitism in the face, and you can also see it coming out in the hind end. All right, so we're going to concentrate on coccidiosis, and coccidiosis can affect cattle, sheep, goats, chickens, cats, dogs. The nice thing about it, though, is that it is host specific. It is even host specific between sheep and goats. Sheep and goats can share a lot of different diseases if you keep them together, but they have different coccidia that inhabit their bodies. So, what is coccidia? Microscopic single cell protozoa. There are 10 different species that affect sheep and goats. Not all of them are going to cause disease outbreaks. When you do a fecal for a sheep or a goat, you may see a few of these coccidia, what we call oocytes, in the microscope slide, and they could just be from a normal animal that has a normal population of coccidia in their system. It only becomes a problem when the animal is stressed somehow and those oocytes just kind of explode and cause diarrhea. Okay. So again, coccidia can affect both sheep and goats. It is going to affect them in the exact same way, except for they've got just different species of coccidia in each of those two different animals. So in the feces, even in a normal pellet, oocytes can be passed, and they're called unsporulated. It's going to take a couple of days of being in warm, wet weather in order for that oocyte to what we call sporulate or hatch. And at that point in time, they become infective to the animal. So if the animal was to graze near a fecal area or lick themselves or eat out of a contaminated feeder, they are going to be ingesting those sporulated oocytes. So this cycle could be only 2 to 7 days in length, depending on the weather. And here in North Carolina, where we have a lot of warm, wet days, that's going to speed up the process. So coccidia has two parts to the life cycle. This is the part that is free living on the outside of the animal. And then once it's ingested, it becomes the parasitic phase. And we'll talk about that in just a second. So if you think about where all the feces live or are deposited in your barn or your pasture or your pens, after those animals go to the bathroom and you think, okay, there's oocytes in that feces, how can I get rid of them? Obviously, removing the manure is a good start, but those sporulated oocytes are resistant to environmental conditions and can actually live, quote unquote, live for up to a year in places that are dark and wet. They aren't easily killed with ordinary disinfectants. So it is really recommended that we have dry environments and direct sunlight to actually kill these oocytes before they become ingested again by the animal. So a lot of times we'll see coccidia outbreaks in confinement systems where animals could be crowded or oral fecal transmission is more common than, say, being on pasture or having a lot of space around them. So we'll go back to the life cycle. Once that animal has ingested those sporulated oocytes, and again, it could just be from licking their leg where they had some manure on their leg, or they laid down in straw and got dirty, or it could be that they stepped in their feed pan and then we dumped feed on top of it and then they ingested them that way. There's many ways you can get transmission. Once those enter the body, the sporozytes are going to go into the cells that line the small intestines. And it's there that they reproduce and then invade more of those epithelial cells that line the small intestine. So this is small intestine. And you can see some scarring here. Basically, the coccidia, what they're doing is they're destroying the lining of the small intestines. And why is that important to the animal? Because the small intestine is where the nutrients and the water and the fluids are absorbed back into the body for maintenance and growth. When we have this damage to the small intestine, if it's long enough and severe enough, these animals could could be what we call poor doers. They never really grow well because no matter how much you feed them, their small intestines are not able to absorb those nutrients, so they're passing straight through. If this gets bad enough, you could see some blood in the feces from where there's ulcers. And again, the quicker you treat this and the shorter period of time the animal has the diarrhea or the disease outbreak from coccidia, the quicker they're going to get back to normal and maybe their small intestines can heal. So who is at risk for getting coccidia? All animals are going to naturally carry a small population of coccidia. It's sort of like gastrointestinal parasites. We know we can never get them 100% completely worm-free for a long period of time. So we're learning how to take care of them properly and manage that load. But the young animals are the ones that are most at risk from having a disease outbreak where they get severe bouts of diarrhea and dehydration and go off feed. Usually after about a month of age, the animal is losing the immunity that it got from its mother's colostrum, and it's being challenged by different pathogens in its environment. And it's generally not going to gain its own immunity to different things until it reaches 6 to 8 months of age. So that time frame in between is where they're susceptible to a lot of different things. If these animals that are young are also living inside of a confinement system where it could be crowded or wet or dirty, they're going to have more potential to transmit the coccidia via ingestion. If you have young animals that are not being fed well and they already have low immunity and their body is not able to fight off diseases, they're going to be more at risk. But we see the most coccidia outbreaks during a time of stress, usually around weaning. So, sheep and goat producers are going to wean their animals at different times, generally maybe between 2 and 3 months of age. At that point in time, the animal is taken away from its mom, its diet is changing, its location may change, it's with other animals that it might not be familiar with. So there are a lot of things there that are stressing the animal out. If that animal also has to be transported somewhere and is handled by multiple people, given vaccinations or dewormers, all of these things can contribute to a coccidia outbreak. They probably have already ingested those oocytes and they're just kind of lying in wait for the right conditions. Even a long stretch of bad weather could bring on a coccidia outbreak. So these are just a bunch of young kids. I just wanted to show that this is the age between 1 and 5 months old that you have to be most observant. All right, if you don't see diarrhea, does that mean that they have coccidiosis? So most animals could be considered subclinical if they do not have very prolific diarrhea. And so subclinical animals may appear normal at first, but like I said, their small intestines are being damaged. So that's going to reduce their feed intake, their feed conversion. They're not going to grow as well, and they'll be poor doers for their growing period. These are actually more economically costly than the ones that have the huge diarrheal outbreaks. So if you look here, there's a doe right here in the middle. These are all half sisters. They all have the same father and just different mothers that are probably aunts and sisters to each other. But for some reason, this one right here drew the short straw, and she just never would do right. She would have bouts of diarrhea, and then she would get better and have bouts of diarrhea, and she never really grew, even though her management and her genetics were identical to the rest of them. Clinical signs are going to be mild diarrhea that, if not treated, is going to get progressively worse and cause dehydration. So it's really the dehydration of the animals that kills them, not necessarily the fact that they have coccidia. It's the fact that they have dehydration. You could see them have a really rough hair coat or open fleece. They don't have a good appetite. They become weak and anemic. So these things are very similar to what you would see with other gastrointestinal parasites. but you may see some blood in the diarrhea, and that could be one indicative sign that it's coccidia instead of something else. So if I have an animal with scours or diarrhea, how do I know that it is coccidia and not something else? And this is a really loaded question because it can be hard to determine what it is the cause of it. You can do a fecal test on these animals. Anything with over of a 5,000 oocyte per gram count is going to be too high, right? You can at that point in time say, yes, we've got a coccidia problem, but you may not see very many of these oocytes in the feces because animals can become sick before they actually start shedding. It takes a really big stressor event to have them shed the oocytes. And then not all of the oocytes, there's 10 different species that affect sheep and goats. Not all of them cause disease. And so even if you see a few in the fecal, they may not be the ones that are causing the diarrhea or the problem. So you can ask yourself, are the animals over 21 days old? Generally, coccidia is not going to affect animals that are under the age of 21 days old. Other bacterial infections are probably going to cause diarrhea at that age. Do they have other parasite infections? It's possible that they've got Haemonchus, Trichostrongylus, tapeworm, and coccidia. So you're not really sure what you're treating for. And then a really simple question I ask myself when I see diarrhea in my herd is, has there been a change in the diet? Did I open up a new pasture? And they got into something that was really lush or really high in protein, and that kind of, upset their system. So we could probably add even some more differentials here to what else can cause diarrhea in a sheep or a goat. Trichostrongylus is the gastrointestinal worm that we call the scour worm or the bankrupt worm because basically it will give you diarrhea that looks similar to coccidiosis, and the animals just don't do very well, don't absorb a lot of nutrients. Tapeworms, enterotoxemia, or Clostridium from overeating of grain could cause diarrhea. Salmonella, E. coli, Cryptosporidium, viral infections, and then a change in diet. So obviously I did not let this goat eat very much in the grain bucket, but I just wanted to share with you that if you do have an escape artist and they do get into your grain, that could give them diarrhea and upset their stomach, and they could get enterotoxemia. If you have really good pastures, which I strive for, but if you have pastures that are really high in moisture and or high in protein, like this clover patches, that can also trigger diarrhea in the animal just because there's a lot of extra protein and water now flowing through their system. So how am I going to treat it once I say, okay, yes, this is a coccidia issue and nothing else? Typical dewormers like Ivomec or Cydectin, Panicure, they're not going to work on the coccidia because they're protozoa. They're not, nematodes. These sulfonamides and the improlium, so Albon, Dimethox, Courage, you may have heard of before, they are not labeled for sheep and goats. So while they are used very commonly in the industry, you have to specifically work with your vet for those extra label use guidelines. How much do I give, and what is the withdrawal on meat and milk for using those substances? I have seen several animals, young animals, that have actually gotten polio from a thiamine deficiency after being given, say, a 5-day treatment of Corid. That in my experience has been very common. So what I do is when I'm going to go ahead and do a Corid 5-day treatment on animals, I'm going to go ahead and give them a thiamine shot as well in order to try to prevent that. You can get coccidia treatment as a drench already made up, or you can get it as a powder that you would put in their water. The powder that you put in the water, though, has to be prescribed from a veterinarian, number one. And number two, if you have sick animals, they're probably not drinking like they should. So it is really recommended that you do individual drenching of the animals that are sick rather than just dumping a pack of Corid powder in the water bucket, because probably the ones that need it are not going to get what they want. But if you do decide to go with the medicated water route, just make sure that that's the only water that the animals have, and it forces them to drink the medicated water. And then on top of that, we really want to hydrate them, give them electrolytes, maybe some Pepto-Bismol to coat their system. And this is just some Gatorade that I was using as a just so they could practice. But that Corid really will have a bitter, almost burning sensation in the mouth of the animal. So if you can flavor it with something, the animals will fight you less, especially if you have to do it for 5 days in a row. So I get a lot of questions from folks who don't want to use chemicals in their animals. And so they ask, is there a natural treatment? Is there an organic type of product that I can give? And there are not very many that have been proven with peer-reviewed research, natural treatments for parasites and coccidia, but I will stand by Sericea lespedeza. One of the things I did at NC State University for years and years and years was research the effect of this forage on both gastrointestinal parasites like Haemonchus contortus and coccidia. And definitely having the animals graze the plant or eat pellets. There is a company that will take and grind the lespedeza into pellets so that you can feed that to your animal year round. That will definitely keep those oocyte counts lower. So if you were to do a fecal while they were grazing or eating those pellets, you would not see very, very many. It works really well with the Haemonchus contortus parasite and the coccidia issue. Long-term feeding of Sericea lespedeza has been shown to possibly bind up some minerals and slow the growth of the animal. But I wean all of my kids at home, and then I put them on lespedeza pasture for the entire summer. So lespedeza is a summer perennial, and it will grow from May through August really well. So I put my kids on lespedeza right after I wean them, and that is what they graze for the rest of the summer. That is how I try to limit the amount of chemical dewormers that I'm using, or coccidia medications that I'm using. I have not had any experience with oregano oil, but there have been a few research studies that show it has limited effect. Like, it will decrease the amount of coccidia oocytes in the feces, but not 100%, maybe 50%. So I don't think there's anything wrong with trying it, but it doesn't work as well as some of the other treatments. So how can I prevent coccidia with my young animals? If the farm or your animals have a history of coccidia outbreaks, you could consider feeding a ration that already has a coccidia stat in it. Now, a coccidia stat doesn't kill the coccidia organism, but it will slow down the shedding of it in the feces. So this is a feed tag from one of the main goat feed companies, and they have included this decox or dequinate in their medicated feed for their goats. Now, it's called medicated, but it does not have antibiotics in it. Some people get tripped up by the term medicated. This is not a product that we use in human health, and so it does not need to be prescribed by a veterinarian. You can buy this over the counter, this bagged pellet feed or sweet feed that already has a coccidia stat in it. So there is a product, Bovatec, that's approved for sheep. Rumensin is approved for goats. And then this product here is approved for non-lactating sheep and goats. So how do you use it to prevent these coccidia outbreaks? One way is before the ewes or the dams give birth, you can feed it in late gestation to try to slow down the shed of the oocytes, because think about the environment in which that lamb or kid is being born into and maybe coming into contact with the feces from the mom. So it'll keep the mom a little bit on the healthy side, but it'll also sort of clean up the environment a little bit. The other way you can use a coccidiostat is to put it in the creep feeder 3 weeks prior to weaning. So when these kids or lambs are still nursing their mom and you have a special area designated for their supplemental feed, you can put this medicated feed in that creep area for a few weeks prior to weaning, so that when that stressor of weaning happens, their system has already had a lower number of coccidia in it as to begin with. There's not meat withdrawal on this product. There has been some research that shows that resistance could occur if this product is fed year round. Again, if I was going to feed it, I would only feed it to my weanlings. But again, I have stopped feeding creep feeding my weanlings because they're grazing pasture while they're nursing their moms, and then I put them right onto the Lespedeza, and that seems to have helped me. But again, the cool thing about being a farmer is there's 1,000 different ways to do it right. It just depends on what works for your system. And you can prevent coccidia by putting Corid in the water. Corid is used for a treatment, but it can also be used as a preventative. So I'm going to leave you with this last side. Sometimes we overlook the basics of animal care. Number one, our main mission is to reduce fecal oral transmission. So whether that means keeping the pens where they live or the maternity areas dry and clean, or elevating the feeders, or cleaning out those water buckets if a couple pellets get dropped in there, a couple fecal pellets get dropped in there. So that's the first thing that we should do every day when we go out and care for our animals. Make sure that the young stock have a clean, dry area to live in. Now, this is a hay trough, like a trough feeder. But if you know anything about goats, they're going to jump in it. And so if you use something like this, they're going to every single day poop in it. So there is obviously the chance for transmission at that point in time. You clean these out every day if you can. And then these are very inexpensive feeders for supplement on pasture. They're just PVC pipes cut in half and put on the ground. But every single animal is probably going to put their feet in it during or after feeding time. So you have to be very good about hygiene if you're feeding in these types of systems where animals can jump into them or step into them. Providing good nutrition for high immunity, which includes giving proper vitamins and minerals and making sure all the babies get adequate colostrum from healthy moms, is a good start from day one. Now, like I said, these adult animals are probably going to have a natural population of coccidia anyway, but those young babies aren't used to it yet. So if you have all of your animals in one large group living together, grazing together, those older animals that can handle that high coccidia load are shedding onto your pasture, where your young ones who haven't built up their immunity are also grazing. So if there is a way to keep those young ones separate until they have reached, 6 to 8 months and have their own immunity, that's going to be better in the long run. And then always, regardless of if we're thinking about coccidia or not, we really need to minimize the stress that we bring on these animals. So this is a picture of my does at my farm here in Nash County, grazing a beautiful field of Lespedeza, and I think they look pretty happy. All right, so with that, I'll stop and I will answer any questions you have about coccidia.
Looks like we've got some rolling in the chat here. So we have Escherichia lespedisa all over the farm in various places. How much would you think I could cut and throw into the field in which they're grazing? We do rotational grazing and move every 2 to 3 days.
There's been a lot of work done with the amount of tannins that are needed in an animal's diet to inhibit the coccidia and the other parasites. And I would suggest that the animal needs to eat at least 50% of its daily ration in Lespedeza to really have a consistent effect on keeping those numbers at bay. And Lespedeza only grows, like I said, in the summertime, but Lespedeza hay would work in the winter or the pellets as well. So it's not as if you can go out and cut a couple handfuls of it and feed it to your goats and feel like you're medicating them for the day. They really need to have at least half of their diet in this Lespedeza to really claim coccidia decrease or parasite decrease.
There's a question about milk withdrawals, and I think that might be relating to coccidiostats. I know.
Yeah, I think the coccidiostats are for non-lactating animals. You're supposed to not feed them to lactating animals. Um, so I am not 100% sure what the milk if there's a right time to feed it to a lactating animal and what the withdrawal would be. I'd have to do some research on that.
And then how much of this type of grain do you feed in late pregnancy? Maybe referring to medicated feed.
Gotcha. Yeah. That's a good question. It would go back to, what is the nutrient requirements of your animal? Can you do 50% of their diet in forage and 50% of their diet in grain? Maybe a couple pounds of hay and a pound of this medicated feed. That's probably a ration that I would use at my house for an adult that was getting ready to have a baby.
And then there's a question about the number of oocysts in a fecal count that would warrant treating versus not treating. Some companies, fecal results separate and show the results as low, moderate, high, very high, extremely high. Any thoughts on that?
I don't have a specific number on coccidia, and I have asked the veterinarians at NC State, what their number is for coccidia, and they said it's a really hard question to answer because the numbers could be low and you have a clinical disease outbreak, or you could see a lot of oocytes and not see diarrhea at that point in time. It's easier to say with the gastrointestinal parasites, if you're up into the 1,000 or 2,000 eggs per gram, that's when you would go ahead and treat if you had like that many homunculus infestation. But thinking about the entire herd or contaminating your pastures, if you did a fecal and sent it to a lab and it came back that it was high for coccidia, even though you didn't have clinical signs, you might want to consider doing something to slow down the shedding for the benefit of the other animals that are in that environment with it, especially if they're younger and less immune.
Yeah, I always struggle with coccidia too because it's either like there's nothing there or there's too many to count.
Yeah, yeah.
And it can go from good to really bad in a hurry.
Yes.
Any tannins? Are there other? They asked about pine needles, other potential feedstuffs that may be high in tannins.
There has been some work done with pine bark, and I think it showed when 30% of the diet was pine bark pellets that it helped with the parasites. I don't know that they looked at coccidia. Again, things like chicory could also help, or bird's foot trefoil. They're both high in tannins and could help with the gastrointestinal parasites. I don't know that anybody has specifically looked at coccidia with them.
And there's another question kind of on that same topic about sweet gum, oak leaves. Are these the same tannins as in Lesbodisa? I'm
Hmm.
not sure.
Yeah, I'm not sure what the percent of condensed tannins is in those types of woodland, woodland plants. I want to say that Sericea lespedeza, correct me if I'm wrong, but it may have like 8% condensed tannins in it. It's a higher number. So there are some lower tannin lespedeza varieties that you could plant or that naturally occur, but it's the tannin percentage in the actual plant that's what's affecting the parasites. So it's not just the fact that a plant has tannins, it's the amount of condensed tannins that it contains.
And then if you put chorid in the water as a preventative, will they develop resistance?
Um, I've actually never used chorid in the water. I don't like to medicate in the water. I would think, though, that something that you give them access to for a long period of time, there would be the chance that they could develop resistance to it. So I would probably only use the chorid in the water, like in the several weeks before weaning or several weeks before they were going to give birth, and use it for a short period of time around that um, stressful thing. You have any thoughts on that, Dr. Weaver?
Yeah, I'm kind of the same. There's not been nearly as much research on that as compared to like dewormer resistance with
Mhm.
our worm type parasites. I My approach to coccidia is yeah, strategic feeding. I don't give it to animals year round. Don't encourage folks to give it to animals a coccidia stat year round. But during selective times when we're in high risk stages of production, I think they can be very beneficial. And I think there was another question I think we might have kind of answered. If you put chorid in the water as a preventative, how many days do you recommend?
I want to say the package says 5 or 10. I think it gives you two different options if you want to do a 5 day regiment or a 10-day regiment. But again, just have to look at the back of the package for that. It tells you how to mix it up.
There's a question about establishing Lesbodisa, and do you have pastures that are solely Lesbodisa, or are you able to mix that in with some of your other forages?
When I was a very young graduate student, I thought that I could mix Lespedeza in with everything, and it would be hunky dory. But actually, Lespedeza does not like to be grown with other plants. It actually, and this goes against, if you're a pasture person, it goes against what you believe in, but it actually likes to be a monoculture. It doesn't share its space well. And so, what we've done at NC State is we planted pastures blocks of Lespedeza right next to blocks of other types of forages, and then gave the animal access to both the Lespedeza and, say, the millet or the sorghum, so that they could go back and forth and eat what they needed and self-medicate. It worked really well to give the animals a choice, but we did not sow or plant those two things together. We had a better germination and a better growth when they were planted next to each other, and then we were just creatively fencing them in. The other thing is it's very hard to establish Lespedeza. It's a very small seed and it germinates and grows very slowly. And you would usually be sowing it in April. And if you think about our weather and other things in April, like weed pressure, um, with a slow growing Lespedeza, if you haven't done some cultural weed control or spraying beforehand, you're probably going to get a large amount of weeds that shade out that small Lespedeza plant. So it's not something that you can plant and forget about. You actually have to manage it quite closely so that it doesn't get taken over. This is a very pretty picture of my Lespedeza field, probably 2 or 3 years after I established it. If you overgraze parts of it, there will be weeds or crabgrass or other things that come up in here. And you'll eventually lose your Lespedeza stand, but you should plant it as a monoculture in my experience.
And did you use the AU Grazer variety?
Yes, the AU Grazer variety from Sims Brothers in Alabama is the best place, in my opinion, to get the Lespedeza variety that has a high enough level of tannins and is also palatable so that the animals will graze it. So it's the best of both worlds there. So it's AU Grazer.
And then
I
do you know of
called
any?
them. I called them this week to get a price on it because it generally is expensive. Last time I bought it, it was about $4 to $5 a pound, which is on the expensive side. But if you manage it properly, it's a perennial, so it could, be established for 10 or 15 years just fine.
And do you know if there's any extension publications related to that and establishing it in pasture hay fields?
Yes, I believe that the Small Ruminant Parasite Consortium has put out one or two fact sheets on getting it established. Right now, I don't believe that there is a herbicide that is labeled for Lespedeza. So after you plant it, I don't think that there's anything labeled to spray to control weeds after the fact. I think that work has to be done beforehand, or while it's growing, you have to very selectively mow the weeds off the top of the Lespedeza. But I do believe the consortium has a fact sheet out.
I am working on finding a link as we speak. Um, while I'm working on that, there's a question. Contact info for Sims Brothers. Do you have that readily available?
I can look it up right now. Yeah, I just called them yesterday trying to get that. They also are the ones that started the Lespedeza pellets, but now they have two mills that are making the pellets. I was calling them again to get the price for the pellets because I do believe a 50-pound bag of those Lespedeza pellets are very expensive as well. All right, so I do have a phone number. I could put it in the chat. Let me put it in the chat.
That'd be great. And I also in the chat shared a link to the Consortium for Small Rodent Parasite Control, their fact sheet on Lespedisa, which includes some establishment information.
And Andrew, I'm pretty sure that Southeast Agri Seeds carries AU Grazer, so any
Okay,
dealer with them should be able to have access to them.
awesome. There were a couple of questions in the chat related to some treatments and what might be going on with animals. And I would just encourage you to work with your veterinarian. I'm not a veterinarian. Dr. Glennon's not a veterinarian. We cannot diagnose disease in your animals. We can certainly help and happy to help with preventative measures and some of those proactive things that we can do to minimize the occurrence and prevent some of these issues from coming back at another time. But unfortunately, we can't necessarily give a lot of advice on treatment or diagnosis of those diseases. And Dr. Glenn, if you have any other thoughts on that, um, just don't want to get too far in the weeds on trying to figure out what's going on in specific
Yeah,
situations.
it's not that we don't want to be helpful, but our hands are kind of tied a little bit by the fact that we are not practicing veterinarians. Again, I can share what I have done and what has worked with me, but I'll always default back to your vet. I will say that if you are in the eastern part of North Carolina or around Wake and Nash County, I am trying to do a needs assessment on what the small ruminant producers need in this area. And I'm sure Dr. Weaver and other agents have done it in their area. But if you do live close to Wake or Nash County and you have a burning desire to learn about something else or even more on parasite control, please send me a note. I'll put my email in the chat because I would love to hear what you guys need from us.
And we opened up the poll here. So if you don't mind taking a minute here to answer the poll, if you have any final questions, feel free to write those in the chat. If Dalton is still on here, Dalton, do you want to share any thoughts, a comment on North Carolina Sheep Producers Association? We're working with them on some of these programs, and um, we meant to, or the original intention was to have this be a hybrid event and have part of this be in person, live at the Johnston County Extension Office, and then due to a low number of folks that indicated they could come in person, we thought we'd just do it all online this evening. But I'm having working with sheep producers on that, and um, I'll let Dalton share some comments on sheep producers and the value that organization provides.
Yeah, so I'll just be pretty brief here, but the for those of you that aren't aware, the North Carolina Sheep Producers Association, it's a nonprofit organization, and their purpose is really to encourage, support, promote, assist, and educate the diverse community of the North Carolina sheep producers, and to strengthen and advance the sheep industry and all other agriculture interests in North Carolina. And so they kind of strive to promote understanding and cooperation in the sheep industry and common interests of producers and consumers. So they did partner with us on this small ruminant webinar series and in-person events this year. And if you're interested in learning more about them or joining, when you do join them, your part of your fee goes to ASI. So you're also becoming an ASI member by becoming a North Carolina Sheep Producers member. So if you're interested, you can just Google NC Sheep Producers and their website will come up, and you can learn more information about some of the things that they offer. They always have a big annual meeting, and they usually partner with the extension to be able to host and bring in some good speakers. So if you're not aware or not already a member, I encourage you to reach out and get in touch with those folks if you're interested in becoming one. Dr. Wade, do you have anything else to add about sheep producers?
I don't think so. Yeah, that's great, and thanks for sharing. And if you're not already a member, I encourage you to sign up and become a member of that organization. We also have one more event coming up at towards the end of April. So it's close to 2 months away from now, but it is the end of next month. So April 30th at the Iredell Extension Office there in the central part of the state. We're going to be talking about biosecurity and disease management. And so if you would like to attend, whether in person or on Zoom, encourage you to do so. Dalton, do you have a link to the flyer, or I can pull it up real quick?
I just pasted the registration link for the Iredell County one in the chat.
Perfect. So invite everyone to join us there, and should be a good discussion again. And that will wrap up. That'll be our final educational program here for the spring. We'll wrap up the series, and so hopefully look forward to a good turnout there. Any other final questions? We'll give it another minute or two here, and if you haven't had a chance to do the poll yet, excuse me, if you can do that, answer that poll, that would be great.
And I'm happy to help anybody in this area with any types of pasture or forage questions as well. That's kind of where parasite control and forage production is where my passion lies. So I'm happy to answer any other questions after tonight if folks in this area want to learn more about that stuff.
Yeah, definitely reach out to your local extension folks, and that's what we're here for, and happy to help. And if we don't know an answer, we'll help you find an answer. So um, definitely reach out. There was a question that came in about bioworma. Any thoughts on bioworma?
Yeah, I have wanted to try bioworma. Basically, that is a feed additive, a spore that you've put in their ration, and they have to eat it every day. Basically, it comes out, it just goes untouched through their digestive tract, comes out in their feces, and then basically it's going to trap the nematodes like Haemonchus or Trichostrongylus that are in the larval stage while it's hatching out of the fecal pellets. I have not tried it. I would like to try it, but because I don't feed a supplement every day, it would be very hard for me to administer the amount of biowarma. But if that's the management strategy that you've got at your farm and you were able to give it to them, then it's worth the shot. I think it could be I think it could be beneficial if you start it again in the early part of the season before your parasite load on your pastures got too high.
Any other final comments, questions?
Thanks everybody for joining us tonight. I appreciate it.
Thank you, Dr. Glennon. Thank you, everyone, for joining us. Enjoy what's left of your evening. And for those of you that live in North Carolina and maybe elsewhere, it looks like we're going to get a nice stretch of warm weather here for the next few days. So get some grass growing, and spring is in the air. So exciting time of year. Thanks again, and we'll see you all at the next event.